Well, let me point out PET is positron emission tomography, which is a nuclear technique which has been around since the early 80s. Magnetic resonance came 20 years after. So PET is now a mature technique to assess fully quantitative myocardial blood flow, myocardial perfusion. As to magnetic resonance, the assessment of quantitative myocardial perfusion is possible, but it's still in its teens, so it's mainly a tool for research. As to myocardial ischemia, there was a paper published, the first author is Lance Gould in 2013, reporting around 5,000 studies with positron emission tomography to assess myocardial ischemia. And it is an expensive technique, but is the best technique to assess myocardial blood flow and myocardial flow reserve. Magnetic resonance is better suited to assess a previous silent myocardial infarction and to quantify the extension of the myocardial infarction. So let's say there are two techniques that can be complementary. And there are many papers on infrasize assessment with MRI, and the technique is very, very sensitive because you can detect 2% of the LV mass infarction, and this has prognostic implications. The same can be said for flow reserve assessed with PET. It has prognostic implications, mainly in diseases that are diffuse impairment of the microvasculature, like hypertrophic cardiomyopathy, be it primary, congenital, or hypertensive cardiomyopathy, and also in heart failure with preserved ejection fraction. This is still a field that needs to be explored because it's still an ill-defined disease. We are trying to characterize it. Cost is the Achilles heel of positron emission tomography. So it's a sort of third level investigation, because let's say in Europe it's in between 1,500 and 2,000 euros an investigation. The pound is now outside the Europe, but it's around the same amount of money. So you need to highly select the patients. There is no point in prescribing a PET scan if you just want to see if there is a significant stenosis. This is not the tool to use. It is cost effective in patients with microvascular dysfunction, because these are patients that undergo endless invasive investigations. And there is no significant stenosis, so you go back home, but you still have pain, you have symptoms, and this is the best indication for this kind of patients. For magnetic resonance, the costs are less, between 500 and 1,000 euros. It depends on what the investigation is. And it's cost effective again if you are looking for a better definition of infarction, if you want a qualitative assessment of ischemia all in one session. So I use both the techniques. I think we have to increase the awareness of the prescribing cardiologists of the limitation of the technique, or what you want to obtain. They are not to be used as a shot in the dark. I don't understand what this patient has. Have a look and tell me what's going on.